I want to show you how a fascial restriction massively affects your pelvic floor, and in our opinion, how to address it without torturing the poor pelvic floor, but balancing out the whole system. So let's go ahead and create a myofascial restriction so you can see the distortion in the muscles and the connective tissue, and imagine how that is affecting all the way down into the pelvic floor. So if I'm going to torture Aaron again and pull him, right? And I'm going to create just a restriction at the lateral leg here. And you can see that we've got this pull of muscles connected to, and this connects all the way into the pelvic floor because it affects also your hip rotators, which literally interdigitate into your pelvic floor. So if someone's got a restriction here, right? And you could look at that right there, that continuity that goes all the way on the inside to the pelvic floor. And they're exhibiting chronic pelvic pain syndrome, prolapse symptoms, and many other diagnoses that can be given to any kind of symptoms of pain and dysfunction here. If they just keep trying to treat them at the pelvic floor, first of all, pardon me, but who the heck wants anyone to mess with that area, okay? If they keep treating that poor pelvic floor, but ignoring the fact that the whole person's system is adapting, no amount of pelvic floor treatment, strengthening, release, etc., is going to resolve things unless I look at the system, I open up where I see the restriction, I balance things out, and all of a sudden, everything balances out through the pelvic floor. So even though it seems like a very specific area, always step back and think big, especially if you've got any chronic pelvic pain syndromes and you've tried everything in the kitchen sink when it comes to actual therapy of the pelvic floor and you're still not getting the results you're looking for. Chances are you need your myofascial system assessed to actually get relief and full resolution of the problem.